Thanks everybody for coming tonight. I'm Professor Andrew Schroeder. I'm not going to say very much. You're going to hear presentations about 3 very important global health charities, and you all should have little vouchers and program type things that'll give you a little bit more information, and then at the end of the evening we'll set up a box in the back of the room and you guys can decide where to send a big donation. So without further ado, first up you're going to hear about the Against Malaria Foundation.
Hey everyone, thank you for coming tonight. We really appreciate you being here. We are presenting on behalf of the Against Malaria Foundation, and we are looking to maximize your global health charity contribution tonight. So there are 3 essential considerations in selecting a global health charity that will maximize the impact of your dollar, which is folks that you have on the table right now. The first is, does it target a disease that impacts large numbers of society's most vulnerable members? The second being, does there exist a life-saving treatment for the target disease? And third, will your donation, thank you. Will your donation go toward proven and effective solutions that leverage this treatment?
Thanks, Cole. We'll start by looking at how the Against Malaria Foundation targets a disease that impacts large numbers of vulnerable people. So to give you a little bit of background on malaria, malaria is contracted through the bite of a female Anopheles mosquito that's been infected, and symptoms can range from a severe flu, right, vomiting, headache, dizziness, all the way to death, unfortunately. And last year, according to the World Health Organization, there were more than 200 million new cases of malaria worldwide and more than 400,000 deaths as a result of malaria. Even more sadly, though, these cases are really concentrated in one place. They're concentrated on the continent of Africa, and the vast majority of cases occur in sub-Saharan Africa, and that goes for both cases of malaria and deaths. Even more sadly, most of those cases and most of those deaths are in pregnant women and children under the age of 5. Children under the age of 5 deaths last year comprised 2/3 of deaths globally just in this region alone. So malaria clearly affects, the most vulnerable of the most vulnerable members of society. Looking to reduction in cases, unfortunately this region has also lagged behind the rest of the world. There were only 32% reduction in cases of malaria in sub-Saharan Africa over the past 15 years, compared with a 53% reduction globally. And when you think about the compounding effects on each of these countries, think about the fact that for every single country, they spend $300 million a year on healthcare costs related to malaria alone. That over a 15-year period, that's money that could have been spent on education, infrastructure, or other healthcare interventions. And since malaria doesn't make the front page of the Washington Post too often, we wanted to give you a comparison. Last year in the United States, there were 33,000 deaths from guns. That's something that you all are very aware of. There were more than 10 times the number of deaths last year due to malaria. Luckily, though, malaria is a huge problem, but it's a problem with a solution, and Ben will tell you more about that.
Thanks, Tyler. So luckily, there is a highly cost-effective solution to preventing malaria. And this is the use of long-lasting insecticide-treated bed nets. So I'm sure many of you guys are familiar with these types of nets. Have any of you guys slept underneath any of these when you've maybe traveled or studied abroad? Okay, so you have a good sense of what these are, but basically they work in three ways, right? So the first is by directly repelling mosquitoes. The second is by serving as a physical barrier, blocking a mosquito from reaching a person. And the third is by acting as a mechanism to kill mosquitoes. So basically a mosquito will land on the net, pick up the insecticide on its feet, and die almost instantly in what's called a knockdown. So these are highly effective, and at only about $2 to $4 per net are also extremely cheap. So I also want to talk about 2 potential concerns that might be brought up about these nets. And the first is, what if they get holes over time? Or what if they get tears in them, right? But this also isn't a problem. So mosquitoes aren't that nimble. And so basically, they'll land on the net if they're trying to target a hole, then they won't be able to just fly right through the hole. So they'll land on the net, try to migrate to it, and they'll be dead before the time they reach it. So this means that mosquito nets, even with holes, are 99% effective. Additionally, you might be wondering if this insecticide is safe for everybody. You're going to have lots of families, you're going to have children, underneath these nets, so it's really important that this insecticide is safe. And so all studies that have investigated any potential adverse effects from using these long-lasting insecticide-treated nets have shown them to be completely safe for pregnant women and infants and everybody. So, that's the reason why this is the best method of preventing malaria, and the reason why the Against Malaria Foundation has been the highest rated charity by GiveWell, a well-regarded independent charity evaluator.
Thank you, Ben. So moving on to our third consideration in choosing a global health charity, is your donation going toward a proven and effective solution delivered by a trustworthy source? So the Against Malaria Foundation is a UK-based charity that provides long-lasting insecticide-treated nets to countries in sub-Saharan Africa. The Against Malaria Foundation's role in distributing nets is first, identifying geographic regions with the largest funding gaps for nets and the most severe need, and then secondly, identifying distributors to actually distribute those nets on the ground. So the requirements for being a distributor to partner with GiveWell are pretty strict. Distributors are required to first submit a planning document with extensive plans for how they're going to distribute the nets. And then following up after the distribution, provide photos and videos of the distribution. And then at 6-month intervals, actually do post-distribution checkups with the households where they've distributed the nets to ensure nets are being used and being used properly over the long term. So this ensures, first, AMF is using its resources efficiently by partnering with distributors, so they're not spending their resources building up infrastructure where it already exists to distribute the nets. Second, nets are going to places where people do not already have them. And third, nets are being used properly and being used over the long term, and there's strong processes in place for monitoring that.
Thank you, Emily. As Ben previously mentioned, this GiveWell, this organization that we keep bringing up, is an organization that's an independent nonprofit that's focused on determining the best charities that you could give your money to. And AMF, like a few other organizations over here, have consistently, GiveWell, like a few other organizations, has consistently ranked AMF highly. And we believe that the reasons for that can be summed up in 3 main points. First one, we believe that GiveWell, as previously Emily mentioned, is able to use a bunch of sources to accurately pinpoint the places where the largest funding gaps exist and target them effectively for the maximum benefit. Second, AMF is not only able to make sure that your donations actually reach the recipient, but it is also able to make sure that the recipient is able to use and utilize the nets for a sustained period of time. And lastly, their commitment to holding themselves up to a high standard by making their delivery reports and public reports very transparent helps them be a top charity that you should donate to.
Great. So now that we know why AMF is one of the top charities to target this pressing global health problem, let's take a look at exactly where your donation would go. Here's a high-level overview of a cost-effective analysis per life saved. Let's assume a cost of about $5 per net. We know from an external malaria intervention review that about 1.8 children are protected per net, giving us the cost of about $2.50 per child protected. Taking into account from that same external review that a little over 5 lives are saved per 1,000 children protected, gives us a number of about $500 per life saved. $500 to give a child back her future. But know that your donation does more than just save one life. For as many fatal cases of malaria that are prevented, so too are many non-fatal cases as well. It's estimated that for each malaria death prevented, so too are 320 malaria episodes, which goes back to what Tyler was referring to earlier, that intense flu-like episode that can last between 6 to 10 hours. You can rest assured that your donation to the the Against Malaria Foundation will not only save lives but improve livelihoods for some of the most vulnerable populations in our world.
So let's return to our original metrics. So to maximize your donation, it's really imperative to consider 3 main considerations. And 1, does it target a disease that impacts large numbers of society's most vulnerable? 2, does it offer life-saving treatments? And 3, are the solutions cost-effective and proven? So let's consider 2 other options for your donation and how they meet these 3 conditions. So first of all, PHC, which is Project Healthy Children, targets undernutrition, which leads to preventable diseases such as blindness, compromised immune systems, and birth defects. And a solution to this would be micronutrient fortification, which can lead to better health, greater productivity, and cognitive growth. So this is a very important work that PHC does. However, we do not believe that its solution is life-saving. So some studies have shown minimal evidence for decreasing levels of micronutrient deficiencies. And also, treatments can potentially lead to adverse health outcomes, including increased rates of cancer and malaria. So lastly, the cost effectiveness of PHC solutions are not proven according to GiveWell, and you cannot be sure what your donation will accomplish. So while we understand the costs of micronutrient fortification, insufficient monitoring data makes it difficult for us to understand the effectiveness of PHC's solutions. Additionally, PHC is unsure about the long-term allocation of its funds. While it's currently focusing on the design and implementation of these programs, it's considering moving the direction to more of evaluating and monitoring these programs. So given that it's not really sure of how it's going to allocate its funds in the long term, you cannot be entirely sure of how your donation will be used.
In a similar vein, the Schistosomiasis Control Initiative focuses on schistosomiasis. Second to malaria is the most common parasitic disease, to draw your attention to the screen here. It's largely concentrated in African nations and can cause kidney disease, intestinal damage, and anemia in children. So certainly targeting a worthwhile cause. Unfortunately, deworming pills, while useful in many cases, are rated likely to have little to no impact by GiveWell. Also, drugs are sensitive. Putting something in a child's body is sensitive. And incorrect storage or improper dosages for children can lead to adverse health outcomes. Finally, we have doubts about solution effectiveness. There's weak evidence connecting reduced worm loads to improve life outcomes, and the impact per child treated is lower in SCI areas than those targeted by the World Health Organization for study. So ultimately, we feel as though these 2 organizations do not fit the criteria that we have shown for where you would find the most impact for your dollar tonight.
So in light of these 3 important considerations, let's revisit the strengths of AMF. So first of all, it clearly targets society's most vulnerable populations. 2/3 of the world's population is at risk, and about 300,000 African children under the age of 5 die every single year from this.
When we talk about life-saving treatments, whether or not these are going to actually impact the lives of people, long-lasting insecticide-treated bed nets are 99% effective, even with slight damage, and they last 3 to 4 years. And 50 to 250 nets save 1 life and 320 debilitating malaria episodes.
AMF also can reach a cost effectiveness of about $500 per life, and all of its merits can be summarized in one fact, in that it's rated as the #1 charity by GiveWell and also ranked very, very highly according to many other organizations. So in conclusion, the Against Malaria Foundation excels in each of these categories and is the clear choice for your donation. Thank you very much. QR code.
Where is? Are you comfortable cooking for you? Me cooking for you? I can. I don't really know when you want to go move the graphics up. Like this one? Okay.
One in 4 children under the age of 5 in developing countries are underweight. This is 146 million children. And each year, undernutrition contributes to the deaths of 5.6 million of those children. In order to protect those children and everyone else who suffers from micronutrient deficiencies, we strongly believe that Project Healthy Children, or PHC, is where you should be donating your money today. Every day, more than 2 billion children suffer from not getting the necessary vitamins and minerals to be healthy. These vitamins and minerals that they're lacking include iron, zinc, vitamin A, vitamin B, and folic acid. These deficiencies are known as hidden hunger because the people that suffer from them often aren't aware of it. They're able to get cheap food that is very filling, such as potatoes, rice, bread. However, this cheap food that they have access to doesn't meet the nutritional requirements that they need to be healthy. In the long term, this has devastating health impacts. Hidden hunger leads to cognitive and developmental impairment, blindness, maternal death during childbirth, miscarriage, birth defects, and compromised immune systems, which can lead to a wide variety of other diseases. So it's extremely important that we have a way to combat this. And the best way to combat this is through micronutrient fortification. Micronutrient fortification is commonly accepted by organizations such as the World Health Organization, the Copenhagen Consensus, and UNICEF as being an extremely safe, effective, and easy to implement solution to micronutrient deficiencies. What micronutrient fortification is it's where we find what micronutrients populations are lacking in and add them to staple foods that they already consume. This is very easy to implement because it means that these people don't have to change their diets at all. They can just continue eating the staple foods that they ate before, but get all of the nutritional benefits of a diverse diet. And one of the best charities, actually the best charity at implementing micronutrient fortification is Project Healthy Children. And I'll pass things over to Fiona to explain exactly why that is.
So Project Healthy Children uses a broad framework for all of their implementation strategies. However, they tailor this framework for specific in-country needs. Rather than talking about these steps in the abstract, I'm going to talk you through one of PHC's implementation measures in the country of Burundi. Burundi has had the highest rate in growth retardation in Africa for many years. Because of this problem, the Burundi national government actually approached Project Healthy Children back in 2011, asking them to conduct a national assessment. General assessments and impact evaluations are the first step of any of PHC's programs. They want to make sure that food fortification is needed in a country, understand what deficiencies actually exist, and then understand whether or not food fortification would actually be cost effective in such an instance. After this assessment in Burundi, PHC signed a memorandum of understanding with the national government that led PHC to enable nutrition policy and legislation work in country. This took the form of development of a national task force, drafting of a decree that would actually promote mandatory program uptake that the president of Burundi then went on to sign in 2015, and creation of regulatory training programs to ensure that food fortification standards would be adhered to. This brings me to the next element of the framework, food fortification standards. As you probably would assume, the food fortification needs are not equal across all countries and contexts. PHC draws upon World Health Organization standards for food fortification, but tailors them to specific country needs. PHC did this in Burundi, working with many in-country partners. Then PHC worked to engage industry within Burundi. This took the form of working with maize and flour producers, along with the largest sugar and cooking oil producers, to ensure that they had the technology and knew how to actually fortify their foods. At this point, PHC could then move on to the social marketing aspect. They worked with the Ministry of Health and other health promoters so that people living across the country understood what food fortification was and why it was happening. Lastly, Project Healthy Children promotes regulation and monitoring of all programs. Project Healthy Children has actually created a fortification management information system that is heralded as one of the best ways to monitor and evaluate food fortification programs. This is extremely important because PHC essentially hands over this information system to a government so that they can then track the program going forward even after Project Healthy Children leaves the country. This is exactly what happened in Burundi, and so the Burundi government is continuing 5 years later to implement and fully evaluate the programs that Project Healthy Children helped them start back in 2011. This brings me to Project Healthy Children's overall approach, why we think it is so unique as a global health charity and why we think your dollars should go to PHC. I talked about the large-scale implementation. However, large-scale implementation relies on centrally processed food. Remote and rural areas do not have access to this food, so we need to talk about small-scale implementation. Project Healthy Children addresses this through its Sanku systems. The Sanku is actually a low-cost, highly effective technology that enables small and medium-sized village mills to fortify their own grain. In this way, Project Healthy Children is able to reach remote populations that most health charities totally ignore. This is something that we wanted to underline to show that there are large and small-scale implementations taking place. Furthermore, Project Healthy Children chooses its geographic locations of operation with the utmost care. This is done through the assessment program, but they also really evaluate a government's priorities and strategies. They don't want to go in and put a lot of time and energy working with country partners who will then abandon the programs a few years later. This brings me to the last point, Project Healthy Children's operating model. PHC has a consulting-based model. I've said time and time again that they work with in-country partners. That's because they want sustainable and stable systems that rely on industry and existing infrastructure. This helps promote monitoring and evaluation along with program sustainability by drawing on the resources that are already available and creating many partnerships across industry, across government, across other nonprofits so that programs will continue being implemented. Through this implementation measures, Project Healthy Children reaches 45 million people across all their countries of operation. Now, I'm sure at this point you're starting to ask, how can they reach so many people and make such a great impact? How much does it cost? So I'm going to hand things over to Tommy to talk about cost effectiveness.
Thank you, Fiona. So if you look at a traditional micronutrient fortification system, there's definitive evidence from over 20 different studies that show and demonstrate the cost effectiveness of this approach. Displayed on this graph are some of those cost effectiveness measures in countries that Project Healthy Children specifically operate in. And these are displayed in the green box. The cost effectiveness unit here, as you can see, are in American dollars per DALYs averted. And DALYs, or disability adjusted life years, are just an overall measure of a population's health. So the lower the measure of cost effectiveness, the lower the measure of cost per DALY averted, the better our program. As you can see, in almost all the countries that Project Healthy Children operates in, it takes less than $100 for you to invest in micronutrient fortification to save one disability adjusted life year. This is in contrast to some of the estimated cost effectiveness of the other two programs presented here, and these are shown in orange and blue, respectively. Now, some have argued that these metrics do not apply to Project Healthy Children because our nonprofit has a different operating model, and therefore they argue there's not enough evidence out there showing the actual cost effectiveness of our program. As you may recall from Fiona's presentation, our nonprofit is indeed special in the sense that it does not actually fortify or deliver micronutrients for the most part. Instead, the main value that our nonprofit brings is expertise. It consults government programs on setting up their own micronutrient fortification system. And precisely because our nonprofit doesn't need to spend on fortifying the micronutrients, our costs turn out to be 10 times lower than the cost of the typical micronutrient fortification program. For instance, you could see in the first bubble that it costs around 25 cents per person per year for an average micronutrient fortification program, whereas Project Healthy Children only incurs about 1/10 of the cost at 2 cents per person per year. So is it cost effective, you asked? Absolutely. our program becomes more attractive when you start to consider all the benefits that do not get considered in typical cost-effective analyses. For instance, the effectiveness portion of our cost-effective analysis typically only take into account the immediate health benefits from an intervention. So this would be looking at the reduction in anemia from iron fortification or the reduction in blindness from vitamin A fortification. What this fails to consider is that micronutrients are so essential to human health that there are long-term significant health benefits as well. And these include improvements in immunity, which reduces your chances of contracting infections or also developing non-communicable diseases like cancer. Scientists are also starting to find out that micronutrient deficiency in the parental generation could propagate through to the next generation. The health benefits have economic ramifications as well. It is estimated that in Malawi, which is one of the countries that Project Healthy Children operates in, $600 million a year are being lost in labor productivity due to micronutrient deficiency. And in fact, one study estimates that if we start to take these considerations into account, $1 invested in micronutrient fortification could return more than $9 to the country's economy. And finally, if we consider the educational effects, we know from numerous studies that micronutrient deficiency stunts cognitive growth and development. So these impediments on academic success could once again interact with the economic factors and have unforeseen consequences. Overall, micronutrients are so essential to every aspect of human flourishing. And if you start to consider the exceptionally low costs and also the immense benefits that micronutrient fortification can bring, it's difficult for you to find a better investment for your donation. Thank you.
I think we should use this one. So you think we should just like give them this? I think we should just give them this. Yeah, then hold it across. Okay. Is this on?
Okay. So our group will be presenting on the Schistosomiasis Control Initiative, or SCI. SCI is a charity that functions mostly in sub-Saharan Africa, and it works to treat schistosomiasis and other parasites. And in our presentation, we'll tell you why we think SCI is the best candidate for your donation. So first, we'll explain what the problem actually is that SCI works to address. So schistosomiasis is a disease caused by infection from parasitic worms. These worms thrive in fresh water, as do snails, which are the main carrier of the parasite. This means that if an individual comes into contact with any body of water in a schistosomiasis-affected area, it's highly likely that she will contract the disease. An action as seemingly simple as walking through a puddle of water barefoot can result in contracting schistosomiasis. So schistosomiasis has both short-term painful symptoms and longer-term developmental effects. Some of the short-term symptoms are listed here, from things that are not too serious, from just itching and rash, all the way to very serious symptoms such as enlargement of the liver or spleen.
What a lot of people don't realize about schistosomiasis, and what our colleagues did not mention, is that it's actually, in essence, a chronic inflammatory disease. So a parasite enters the host and takes a long time before that parasite exits, leaving plenty of time to lay eggs in the host's tissues, half of which actually remain in the host and never exit. Having eggs trapped inside the human tissue lead to chronic disabilities, including cardiopulmonary diseases, malnutrition, and even an increased risk for HIV. These chronic symptoms are actually widely underreported. This is because individuals experiencing them live in areas that have a high prevalence, and the symptoms are widespread, so they mistakenly assume that those symptoms are normal health states. Additionally, there are also fatal consequences of schistosomiasis, including kidney failure, liver failure, and bladder cancer. So what are the impacts of these health states on a life? Both the short-term and the long-term health effects impact an individual and a community's ability to develop. As you can imagine, a young child experiencing frequent pain will have lower test scores and a lower school attendance. Somebody experiencing abdominal pain, malnutrition, cognitive deficiencies, etc., will have lower wages. And those lower wages, even if there's a small decrease in wages, will impact that individual and their family's food production and also quality of life. So our colleagues are arguing for the importance of life-saving treatment, and it would be remiss to ignore the overwhelming and asymmetrical burden that a chronic disability due to schistosomiasis places on rural impoverished communities.
So the World Health Organization, they come out with a list of neglected diseases, and schistosomiasis is number 1 on that list. And these numbers here show the disparity in neglectedness compared to malaria, and it's seen that of the infections, only half of the infections compared to malaria are treated, and this disparity is actually considered to be thought to be even bigger because the diagnostic tool that tests for schistosomiasis is thought to only be about 40 to 60% effective, so there is actually a larger disparity. And now I'm going to talk about what the Schistosomiasis Control Initiative does. They work in collaboration with countries in sub-Saharan Africa, in collaboration with funding and distribution. They advocate for the benefits of mass deworming. So mass deworming allows for treatment without bias, and they are in elementary schools. And Schistosomiasis Control Initiative, they use 2 drugs, Praziquantel and Abenzol, as most of their work is combined deworming, as these worms are prevalent together. And they develop procedures to evaluate their data. They have very strong transparency and self-evaluation measures.
All right, so SCI as a nonprofit has a strong record as being both transparent and effective. So on the note of transparency, SCI has been great about providing financial records, program details, and impact information with the general public, as well as with organizations that evaluate charities. This allows us to see where SCI is spending their money. So on a positive note, for 2016 to 2017, SCI's budget of about $15.8 million is going to be almost nearly fully allocated to providing treatments and executing programs. Now, this is in comparison to charities like Project Healthy Children, who are choosing to allocate most of their budget to evaluation programs. Now, the reason SCI can afford to focus on treatment versus evaluation is because SCI's programs have already been proven as effective. So SCI has conducted studies in about 2/3 of the countries where it provides treatments, and these studies, prevalent studies, showed that the rate of schistosomiasis went down dramatically in the areas that SCI targeted. Specifically, coverage of school-aged children increased to over 75%, which is the minimum recommended coverage level by the World Health Organization. So although evaluating the impacts of these treatments can be difficult, the studies that have been done show that SCI has a proven track record of both starting, implementing, and expanding national deworming programs. So, for an example, let's take a look at the Democratic Republic of the Congo. So in 2013, there was 20 million people at risk for schistosomiasis, but there was only one program in place to try to tackle the neglected tropical diseases. So then SCI was able to partner with other organizations in 2014 and successfully treated 2.2 million school-aged children. And then during the second round of mass drug administration, they were able to treat 1.5 million school-age children. However, even after this positive impact, there are still 16 million people at risk for schistosomiasis in the DRC right now. So although SCI plans to scale up their efforts, they're currently constrained by human and financial resources. So what this means is that an increase in financial resources for SCI will allow it to have an even greater impact and continue the positive efforts that it's already started in places like the DRC.
So for those of you who don't know, there's roughly $2,000 on the table tonight, so your vote will help decide where that large amount of money goes. So we thought an important question to answer is, what does that $2,000 do? With a donation of $2,000 to SCI, we can begin by answering that question by looking at the cost per treatment distributed. At SCI, that cost is very low, at under 50 cents per treatment distributed. The way that they're able to achieve that is by these mass distribution projects through schools. Now, by taking into account the average prevalence in the areas treated as well as the percent of cases cured, we see that we have $1.50 per treatment for a positive case of schistosomiasis, as well as $2.88 per cure. If we take that $2.88 number, we see that with $2,000, we can cure about 700 cases of schistosomiasis. But the impact of this intervention is likely even larger. The important number that we just looked at was the $1.51, because even when people are not cured of schistosomiasis, the intensity of the worms can go down dramatically. The average estimate is 90%. So that's another 600 cases being treated, bringing our impact to 1,300 cases of schistosomiasis, 1,300 children who will live without these developmental disabilities. There are two additional reasons why we can expect the impact to be even greater than 1,300 children. One of those is that even if someone does not have schistosomiasis now, there's an 80 to 90% that they will get schistosomiasis at some point during their lifetime. So by treating schistosomiasis today, by removing it from the host that it needs to reproduce, we can help bring that number down as well. Additionally, we haven't even talked about the benefits of addressing soil-transmitted worms. These are, for example, Ascaris, whipworm, and hookworm, which SCI also treats at no additional cost. All of these worms have been shown to have similar developmental effects to schistosomiasis, so we would expect that number to be much larger. This is especially relevant because some of the areas in which we're treating, soil-transmitted worms are the main target. So in Uganda, for example, the rate for schistosomiasis is actually pretty low, but soil-transmitted worm rates are very high.
So I want to mention one very important effect of deworming that people don't necessarily know about, and that is that deworming reduces gender inequality. Studies have demonstrated that deworming programs can increase the proportion of girls attending school by 1/4, and this increase decreases the gender gap in secondary school attendance by 1/2. Part of the reason for this is that girl children tend to be more exposed to schistosomiasis because they tend to be doing more of the domestic tasks that involve interaction with water, such as washing clothes. Now, this stands in contrast to charities that target malaria, such as AMF, because these charities work by distributing nets to families, and studies have suggested that families sometimes distribute those nets in a way that privileges boy children over girl children, which has a negative effect on gender equality. So to recap some of the things that we've talked about so far, this is how SCI stacks up in comparison to other charities. You can see that SCI has a very low cost per case treated, and you can see that it is more expensive than Project Healthy Children, but that's not the only thing to take into account here. So one great thing about SCI is that it has a very robust body of evidence supporting both its effectiveness and the effectiveness of deworming treatments in general. And furthermore, we think it's important to look at how neglected a disease is. Schistosomiasis is, as we said, the #1 neglected disease right now, and we think that's something important to take into account. And finally, as I just said, SCI gives fair chances to all children to be treated regardless of gender, and this is not the case with all of the charities that we've talked about. So to sum this up, SCI is a charity with a standout track record of proven effectiveness. It's able to help many, many children, and it also needs increased funding if it's going to be able to continue to scale up its operations in countries like the Democratic Republic of the Congo. So we hope that you guys will consider giving your vote to SCI. Thank you for listening.
So what we're going to do right now is we're going to invite each group to come back up really briefly to remind you of what their key points were, and then we're going to open it up to questions from all of you so you guys can ask for whatever additional information you think you need to make your decision. So if AMF wants to come up. There we go.
Does this one work? Excellent. All right. Tonight you've heard from 3 worthy charities and from my fellow presenters on why the Against Malaria Foundation is worthy of your vote. You've heard how hundreds of millions of people around the world contract malaria each year, and many more contract it in sub-Saharan Africa, and nearly 300,000 people in this region die from malaria each year. Most of those are children under the age of 5. But you've also heard about how the distribution of long-lasting nets targets malaria at its root, protecting pregnant mothers, children, and families from contracting malaria. The annual deaths of nearly 300,000 children are preventable. You can prevent them here tonight. Your voucher for the Against Malaria Foundation is supporting the most vulnerable of our globe's most vulnerable in a region that desperately needs your help. I could discuss how the hundreds of millions of dollars sub-Saharan African nations put towards fighting malaria could be used for infrastructure and education and clean water and other healthcare interventions if only these countries could just stop so many of their children from dying. I could make complicated arguments about aggregation of health benefits or cost effectiveness at the margin. I could hit you over and over again with facts and figures and quotes from leading global health experts. I needn't have to. There are hundreds of thousands of children's lives that need saving from malaria each year. The Against Malaria Foundation is saving them. They need your help. See, the incredible, unbelievably hopeful thing about malaria is that unlike so many other diseases, we have the solution. Eradicating malaria requires the distribution of long-lasting nets. Tonight, you can be part of that solution. Look around this room. Each of you has a $25 voucher. At $5 a net, every $500 saves a life. Do the math. This room could save 4 lives tonight. Those are 4 children with futures, 4 families left unbroken. Cast your voucher for the Against Malaria Foundation. Your voucher matters. It might save a child's life.
Okay, so first, I'd like everyone to reflect back on your meal for a second. The foods that we've eaten tonight have had a variety of nutrients in them, and we can also assume that the salt in our foods have been fortified with iodine. Now think of the many people in other countries who heavily rely on non-fortified grains and rice for basic sustenance, causing them to face a lifetime's risk of severe health conditions. Your $2,000 in donation to PHC can go towards providing more than 7,500 people with fortified staple foods. This is in comparison to protecting only a third of this amount of people if you donate to SCI, and protecting only a sixth of this amount if you donate to AMF. Can you use this? Hello. Cool. Sorry.
Hello. Okay. Other charities tonight have mentioned that GiveWell has reservations about the effectiveness of PHC. However, today, GiveWell joined Life You Can Save in Giving What We Can and ranking PHC as one of its top charities to donate to. And overall, all the presentations today have noted that there's one thing in common, that health is essential to leading a high quality of life. We have demonstrated that micronutrient fortification is among the cheapest, most effective ways to ensure this quality of life. By donating to Project Healthy Children, you will be ensuring that many people who need micronutrient fortification will receive this, while also ensuring that they are better equipped to deal with things like malaria and schistosomiasis, because we target health at its source. Overall, by donating to Project Healthy Children, your donation will ensure that over 7,000 people can have food for a year. Thank you.
Oh, I'm so sorry. I just freaked out.
So you've heard a lot of information tonight, and so we wanted you to part with one last comparison. As I mentioned in the earlier presentation, there's around $2,000 on the table. So it's very important to know what exactly that's going to do. The first logo you see on the top there in blue is SCI's. So you know that with $2,000 donated to SCI, we can raise incomes and living standards for around 1,300 children. As I mentioned earlier, that's likely to be a huge underestimate because we haven't even talked about soil-transmitted worms. With Against Malaria, you can save about 60% of a life and prevent 185 patients from experiencing the painful but short malarial episodes that they talked about in the last presentation. With PHC, we've seen this an extremely cost-effective organization. There are some doubts that GiveWell and Giving What We Can have raised about the effectiveness, but it does seem like the costs are very low. One thing you might want to consider is that in the next year, PHC has said that they're going to transition from working with governments to implement the programs to working with governments to monitor the programs. While monitoring is obviously very important, you might want to ask yourself whether you want your donation to go to a charity that will necessarily treat children, or go to a charity that will make sure that those children, or that the programs are working as they thought they had been working.
So today we've heard from 3 outstanding charities, but I'd like to remind you about schistosomiasis and how it's the #1 neglected disease globally, affecting millions of individuals, including children. You today can have the opportunity to provide a treatment which will cure this lifelong chronic disease with wide-ranging effects, from health disability to decreased wages to a lower quality of life. The thing about SCI is they already have the infrastructure in place to start and expand deworming programs, and these programs have already been proven effective. Now, what's stopping SCI from having a bigger impact is a lack of financial resources, which you can provide tonight. As shown by examples such as that in the DRC, SCI can treat even more people with more financial resources. So keep in mind the positive impact that they've already been having and how much more there is to do when considering who to donate to today. We personally think that the choice is clear, but now it's up to you to decide. Thanks for listening.
If you have a question, just raise your hand. Kamai and I will come by with the mic.
All right. Hello, everyone. Great presentations. They're all amazing. I really enjoyed them all. I just have a quick question for AMF. So I think the biggest thing with the other two charities was that they worked with governmental organizations and worked with partner institutions within those nations to develop sustainable development. I think one of the biggest issues with nonprofits is that they go in and they do Band-Aid issues, which allows for complacency within development of actual medical solutions. Things like malaria nets allows for complacency within governments to not actually treat the causes of malaria and not actually develop health systems, which is a problem that's happened a lot with the Red Cross in Africa. So how does AMF deal with that issue more specifically with the issue of malaria? How does distributing nets combine with the development of actual sustainable programs and vaccines and other health programs? How does it not block that? In these other two cases, it seems like they actually partner with governments rather than partnering with other things or just distributing nets wholesale.
Well, I know that AMF actually does partner with on-the-ground organizations locally to the nations which they think demonstrate the most need. Emily, do you want to make a point about?
Yeah, so AMF, as you said, partners with distributors. And I think one of the things to note about that is they're actually following up to make sure that they're being used correctly 6 months at 6 month intervals over that 3 to 4 year period that the nets are in place versus other countries where maybe there's governmental instability and those programs aren't necessarily actually going to stay in effect. Does that answer your question, Cole?
I guess I would also add that it's not necessarily that developing vaccines and providing insecticide-treated nets are mutually exclusive things. In this case, the Against Malaria Foundation actually does provide the nets to these individuals, and as Ben was talking about, this is the most effective, the most cost-effective way of preventing malaria in the first place, whereas other organizations like we talked about use a consultation method where they're not actually providing anything to the people on the ground. And it's not necessarily the case that money, in fact, it's not the case that money is not going to vaccine research just because AMF is on the ground giving nets to people to potentially, like we've shown, save lives and prevent malaria episodes. So I see them as things that can happen concurrently as opposed to things that are working against one another.
Hi. Thanks a lot for your wonderful presentations. Those of you that don't know me, I'm 2 doors down from Drew. But shamefully, this is my first time to come to this night, and it was great. All of your presentations were very convincing. So I had a question specifically for the PHC group. So this isn't a question about the sort of specifics of your project, but it's a more sort of general or I guess philosophical question. So I was actually most convinced by your presentation, and I was ready to vote for you. But then, I sort of remembered, the GiveWell ranking, and I started wondering, look, what's more likely that I, after 30 minutes of listening to presentations, have made a mistake about which group is the best one to give to, or that GiveWell, that employs people who spend their entire careers evaluating which organizations you should give your money to, that they've made a mistake. So it seemed like if I vote for you, which is what I wanted to do, I'm not demonstrating the proper amount of epistemic humility, right? I should be deferring to the experts, shouldn't I? Or I don't know.
Yeah, so luckily, in this case tonight, you can do both, because as Khadijah noted, and Professor Schroeder actually told us this morning, that GiveWell has announced that they're considering moving PHC back into one of their top-rated charities. And I was also kind of interested in the question of why does GiveWell kind of give this question mark about Project Healthy Children, though that now seems to have changed literally as of this morning. And all I could find on their website when it was find out what sort of research we've actually done was that they had 2 phone calls and read one document that had been sent by Project Healthy Children, and that was just basically the first step for PHC to get kind of this accreditation. And so it wasn't necessarily, my understanding from that wasn't necessarily that based on that initial assessment, GiveWell had been absolutely not. It had just been that's all we've done. And because they're so kind of well regarded and do all the work, they're not comfortable putting their name behind something until they do a lot more work than 2 phone calls. And I don't fault them on that. Also, it should be noted that other similar ranking systems for charities, such as the Life You Can Save and Giving What We Can, do rank Project Healthy Children as one of their top charities and as the top charity for food fortification programs. And so kind of hopefully taking all of that into consideration, you're able to both go with the past 30 minutes, but also kind of with the experts. Yeah.
Thanks.
Hi, so I have a question for SCI and PHC, both of the groups that work heavily with governments. Zimbabwe was one of the case studies that you mentioned, and recently over the past year, the situation in Zimbabwe for their government has been extremely volatile. Their economy has basically crashed. They've been laying off hundreds of employees. How do you work in those countries with these kind of complex, volatile governmental situations to make sure these programs are still being administered and evaluated as they should be? How closely are they working with governments, and how much of it is the charity doing the work on the ground, and how much of it is relying on the government to continue doing that work once they kind of leave?
Does SCI want to do this first? Because I just talked.
Well, I guess one thing, at least for SCI to consider, is that because they are partnering with governments, like once SCI has left, the governments now have the infrastructure to implement these mass deworming programs. And yes, it's true that if the government undergoes a period of instability, perhaps the government's priority might not be implementing health programs anymore, but I think that's something that's a concern for probably all 3 of us, that if a country is undergoing instability, it would be maybe not the priority to implement this. But I guess I can say that there is, I think for Project Healthy Children probably as well, that there is long-lasting infrastructure to deliver these health goods.
Yeah, definitely. I second what Alice said in terms of like those are challenges no matter who you're working with in country. Obviously, if there's a huge civil war, that's not going to be the priority, whether it's bed nets, deworming, or food fortification. However, part of the reason I wanted to talk about Burundi and noted that the president signed this mandatory decree in 2015 is because there was massive political upheaval in Burundi in 2015, right? And the fact that the government back to 2011 had made this kind of, signed the MOU, but also been like, this is one of our priorities, kind of regardless of what's going on in our political system, really stood out to me for Project Healthy Children. And you can look at examples, at least of PHC, continuing to work in Honduras in the face of a coup when many other organizations left, continuing to work in Zimbabwe, having struggles in Rwanda to some degree when they had the government's commitment did waver, but in the end, being able to implement their programs and feel successful. So those are just kind of case study examples, but I think the fact that PHC like relies on kind of government interest as an initial step, but then also pulls in industry, makes it like, okay, it's not just government, but we have industry buy-in as well, and then with just other partners. Yeah.
I have 2 questions. One is for AMF, and I'm just wondering, because of the statistic that 2/3 of the world population is at risk of suffering from malaria, on whom or which entity do you think the onus for resolving this issue lies? And then for PHC, I'm wondering, like when you look at the World Bank and their efficacy and sort of the places and the projects in which they have failed or had to pull money or a significant amount of money was wasted in efforts to establish different positive things in certain countries. It's sort of related to the last question, but if I'm just wondering if the World Bank is a organization that takes on very big projects, very costly projects, and are not able to see them through or see them to success, what distinguishes PHC as a smaller nonprofit, smaller entity, less powerful, perhaps a less or fewer connections with the government from a place like the World Bank in terms of efficacy?
Sure. So to start with the AMF question, on the statistics side, there are more than 200 million new cases of malaria every year. The 2/3 number was the percentage of global deaths that are attributed to children under the age of 5 in high incidence countries. But in terms of who the responsibility lies with, I would say it would be large organizations like the World Health Organization, the UN. I think the problem being, it's very clear that we have a solution to this, right, in nets, that if we were to actually distribute nets, equitably across the globe, that you wouldn't see the discrepancy between reduction in new cases each year in Africa, and specifically sub-Saharan Africa, that you see in other regions. I think it's a question of money and will.
Okay, I'm taking this again because it's further about PHC's implementation. So there are a couple of things to highlight in response to your question. First of all, we actually think that the fact that PHC is small gives it a unique advantage to effectiveness rather than an organization like the World Bank, which has many priorities. Project Healthy Children's only priority is food fortification, and they are experts in that work. Furthermore, the fact that they work also with in-country partners in a very purposeful way makes them stand out because they have the dedicated energy, time, and resources to just work on an individual level and don't necessarily have the connotation that comes with the World Bank. This is something just kind of about their general consulting model, and they also work kind of by invitation, if that wasn't clear with the Burundi example, but that's how it works in all of their instances. Furthermore, the small-scale implementation measure is totally different than something the World Bank would be able to do because it is extremely community-based. It's going to a community with a small mill, producing flour for the whole community and saying, here's this technology, we'll show you how to use it, and then they can just pick it up right away. And that is something that's different than the consulting thing, and also sets Project Healthy Children apart because the Sanku technology is totally different, and Project Healthy Children is one of the only organizations that implements something like that. So that's another differing factor.
Hi, my question is also for PHC. One main counterargument that the other two charities have offered is that the efficacy of nutrient microfortification is not, the evidence for it is not as strong as the other two. What evidence can you give to support that?
Thank you. So one of the distinctions that we made, and I think that the other groups tried to make, was that PHC is unique in its consultation role. So there is a lot of evidence, and this is undisputable at this point, that micronutrient fortification as an intervention works. There are over 20 studies on that. The World Bank and also the Copenhagen Consensus, which consists of an expert panel that gets together every once in a while to talk about, to come up with the best, most cost-effective solutions. All of those organizations have concluded that micronutrient fortification works. What there is less certainty about is whether or not Project Healthy Children's model of consulting works, because it's difficult when you think about calculating cost effectiveness. It's difficult to figure out the exact value that you contribute to when you consult someone. If I contribute my expert knowledge to help bring your government program up and to help set up a fortification program, how much actual benefit is that? And so because there's some ambiguity in the nature of what PHC does, and because there's some inherent difficulty in calculating cost benefit or cost effectiveness in the traditional sense, there's not as much data on it.
Yeah. I'd just like to add to that a lot of the other groups mentioned and kind of brought PHC down because we're going to be spending a lot of money monitoring our programs in the future. However, this is actually a benefit because right now there is some doubt as to how effective these sorts of, like PHC's sort of micronutrient intervention is. However, as it improves its monitoring and improves the evidence that it has, it's going to encourage other organizations to do the same thing. It will encourage more funding for PHC, which in the long run will lead to a lot more people getting the nutrients that they need in order to be healthy. So that's actually just something that isn't really isn't as bad, isn't a problem as the other groups would like you to believe.
Okay, I have a question. This is for AAMF. So it's fairly well known that these mosquito nets across Africa are used as fishing nets. And of course, the unintended consequence of this is that when they're treated with insecticides, right? They they contaminate water sources and of course fish sources. And it's of course understandable that they're used for this because it's a practical use of something that they are handed. And so I want to know. So for me, this makes me question how effective your organization is. And so I want to know what and if the organization is doing to educate about this and what they're doing to prevent this.
Okay, well, as Emily discussed in our presentation, one of, I think, the unique qualities about AMF and one of the reasons that it is so highly rated everywhere is because they have a really intense follow-up process. And Emily, please jump onto this. This was your area of expertise. And so they really do check in with the distributors that they partner with to ensure that those things that you're talking about do not happen, right? Because we know that we have the solution that Ben discussed with you, how it worked, these ITNs that have an immense ability to save lives, but when used incorrectly, as you mentioned, it's not compelling. However, as I mentioned, what makes AMF unique is that they have processes in place to make sure that these nets are used correctly.
This is quick addition. This is something that GiveWell discusses on the website as sort of like one of the concerns there are about nets, and their justification for the reason they don't think that's an issue with AMF specifically is because they have such robust processes for making sure they're being used correctly. When they're not being used correctly? Does anyone know that? I wish I had a good answer for you. I'm not sure.
Question. So, oh.
I guess, hold on. SCI brings up the point that gender inequality is addressed within the system of providing this donation. I'm wondering if AMF and PHC have a response to that, more particular to AMF in terms of the issue of the malaria nets being given inequitably to men versus women.
Yeah, sure. Two things there. I don't know too much about any numbers on like male to female actual use, but all the studies that were done on it that I saw, about 3 to 4, didn't show any strong evidence that they were leading to any perpetual inequities between genders. Additionally, I think that is like a valid concern, but also removed from the purpose of what AMF is trying to do, and that type of, I guess, like either cultural or moral I guess, custom or whatever is leading to maybe only giving it to, say, like male children. I don't know, they might maybe in their like processes educate and try to enforce that, this is for everybody. But all the studies that I saw didn't find any conclusive evidence that that was like perpetuating like gender inequalities in these regions.
We weren't criticizing PhD for that, it was only AMF, just to clarify.
I just add one thing, and it's that 2 people can sleep under each net, and so it's very common that pregnant women are the ones who are sleeping under the net first and foremost because they have a baby on the way, and so like I think that those are also important lives, and I think that's a strong consideration. Is that if you have, say, 1 child and 1 child on the way, both the mother and the child, no matter what sex, can sleep under the net.
Time we have for questions tonight. Please join me again in thanking our presenters, and don't forget to drop your sheet off.